Diagnosis of tachypnea in infant. Tachypnea is diagnosed in infants based on the age. In newborn, 2 months more than 60 per minute. If 2 months to 12 months or more than 15 minutes. Other symptoms can help the diagnosis, like using unnecessary muscles, trigger sternal intercostal nerve flaring, neck extension, breastfeeding, breathing over 60 per minute, labor with grunting sounds, flaring nostril, head bobbing, imaging lung, ultrasound, chest X-ray, pulse oximeter, transient tachypnea of liver, most commonly in full-term infant, delayed resorption of fetal lung field. Immediately after birth, tachypnea, increased breathing effort, decreased glucose, diminished or lower breathing sound or auscultation. Respiratory distress syndrome, in preterm deficiency of surfactant, symptoms within first few months, first minutes and hours, tachypnea, increased breathing effort, cyanosis, hypoxia, decreased breathing sounds, congenital heart disease, also ECG here, echo. Diagnosing tachypnea in an infant, clinical evaluation, history, onset, and duration of tachypnea. Diagnostic tachypnea in an infant occurs by abnormal high respiratory rate involve careful clinical evaluation to identify the underlying causes, and tachypnea can be a sign of respiratory distress or symptom. Systemic illness here is a structural approach to diagnose the cause of tachypnea in an infant. Clinical evaluation, history, onset, and duration of tachypnea also see the symptom fever, cough, breathing difficulties, and vomiting, lethargy, or irritability. History of recent illnesses, exposure to infectious agent, or choking episodes, prenatal and birth history, including bacterial infection, prematurity or neonatal complication. Physical examination measurement of respiratory rate, normal range varies by age, but generally over 60 breaths per minute is considered tachypnea for infant. An assessment for signs of respiratory distress, nerve flaring, grunting, retraction, use of accessory muscles, auscultation, the lungs for fetus, crackles or decreased breath sounds, evaluation of heart and rhythm, presence of cyanosis, and assessment of hydration status, diagnostic test pulse oximetry to assess oxygen saturation levels. Hypoxemia may indicate significant respiratory or cardiac disease, actually to identify pulmonary conditions such as pneumonia, bronchiolitis, atelectasis, or congenital pneumonitis. Complete blood count CBC can indicate infection, elevated white blood cell or anemia, and blood gas analysis, arterial or capillary blood gases can provide information on the presence of hypoxemia or acid-base disturbances. Electrocardiogram, ECG, to evaluate heart rhythm and structure. Particularly if there's a suspicion of a congenital heart defect or cardiac arrhythmias. Echocardiography if a cardiac cause is suspected to evaluate cardiac anatomy and function. Respiratory fund panel PCR-based test to identify common respiratory pathogens, especially during peak season for viral infection. Common causes of tachypnea in infants are respiratory causes, bronchiolitis, commonly caused by RSV, respiratory syncytial virus, pneumonia, bacterial, viral, or atypical organism, asthma, or airway disease, less common in young infants, foreign body aspiration. Cardiac causes, congenital heart disease, heart failure, other causes, fever, systemic response to infection, anemia, and diminished oxygen carrying capacity can lead to increased respiratory effort. Metabolic acidosis, the body's attempt to compensate for acidosis imbalance. Dehydration or sepsis, systemic illness affect the overall physiological stability. Management consideration. Immediate management is directly stabilizing infant, which may include supplementary oxygen, hydration, and addressing the underlying causes. Hospitalization may be necessary for infants showing signs of significant distress, hypoxemia, or when a serious ambulance condition is identified. High dose of thorough history and physical examination are crucial evaluating an infant with tachypnea. According to substantive diagnostic testing, tachypnea can be a first sign of a wide range of respiratory, cardiac, or systemic condition in infants. Identifying or associated clinical signs such as a fever, cough, or signs of respiratory distress can help narrow the differential diagnosis, prompting recognition and management of underlying causes are essential to prevent potential complications. So let's sum up the diagnosis of tachypnea in an infant. Tachypnea is diagnosed in an infant based on the age. We were 2 months more than 60 per minute, 2 months to 12 months more than 15 per minute. Other symptoms can help in diagnosis like using accessory muscles, tubular sternal intercostal retraction, nerve flaring, neck extension, breathing over 60 per minute, labored grunting sound, blaring nostril head bobbing, imaging long US ultrasound chest X-ray post-oximeter transient tachypnea omniware most commonly informed currently in infants, delayed observation of fetal level field, and immediately after first tachypnea increased. Breathing at for diffuse crackle, diminished or lower grading sound on auscultation, respiratory distress syndrome, quick turn deficiency of suspected symptoms within few minutes, an hour, tachypnea, increased breathing effort, cyanosis, hypoxia, increased breathing sounds, congenital heart disease, also ECG, and here echo. Diagnosing tachypnea history, clinical evaluation, physical examination measure the respiratory rate, assess the sign of respiratory distress, auscultation of the lung for measles, crackle, decreased stress sound, evaluation of heart rate and rhythm, and clinical evaluation onset and duration of tachypnea, associated symptom, fever, cough, feeding difficulty, vomiting, lethargy or irritability, history of recent illnesses, exposure to infectious agent, or looking at the cell preneural and birth history measurement of respiratory. First, diagnostic test, first oximeter, chest X-ray, complete blood count, blood gas analysis, electrocardiogram, echocardiography, viral respiratory panel, respiratory causes bronchiolitis, pneumonia, asthma, or reflective airway disease, foreign body aspiration, cardiac cause, congenital heart disease, heart failure. Other causes, fever, anemia, metabolic acidosis, dehydrogenase, management consideration, IL point authorities to physical examination or visual in evaluating on infant, the tachypnea vying subsequent diagnostic testing. Tachypnea can be the first signs, the wide range of respiratory, cardiac, or systemic conditions in infant, identifying associated clinical signs such as fever, cough, or signs of respiratory distress can help narrow the doctor fresh diagnosis, proper examination, and management of underlying cause are essential to prevent potential complications.